This podcast is copyrighted by the American Society of Nephrology. All rights reserved. All content in this podcast is for informational purposes only and is not intended to be medical advice. This podcast should not be used in a medical emergency or for the diagnosis or treatment of any medical condition. Please consult your doctor or another qualified healthcare professional. If you have any questions about any medical conditions or before or taking any drug, changing your diet, or commencing or discontinuing any course of treatment. Thank you for listening to this podcast by the American Society of Nephrology. So, Lauren, there's been a lot happening with National Kidney Month this year.
Yes, it was quite a busy National Kidney Month, particularly in relation to our activities on Capitol Hill. This month we hosted our annual Hill Day, and we also had a surprise opportunity to be involved in a congressional hearing. And joining us to talk about those two major things are Dr. Suzanne Watnick, who is currently serving as our ASN Health Policy Scholar, as well as the chair of our Policy and Advocacy Committee, as well as Dr. Mannon, who's currently serving as our chair of the Transplant Policy Committee. So welcome to you both.
Thanks for having us.
So maybe we can start with earlier in the month when a group of ASN members went up to Capitol Hill and visited a number of offices, both on the Senate side and on the House side. And Roz, maybe I'll start with you. Just sort of curious as to your overall experience this year with Hill Day.
So first of all, we were blessed by excellent weather, which always makes a good Hill Day. But in all seriousness, we had opportunities to work with both parties, and as you mentioned, both the House and the Senate. And I think it never fails to invigorate me as an American, as a nephrologist, as an academician, to be able to visit these offices and to have an opportunity to discuss kidney disease, kidney innovation, all the issues that we deal with on a routine basis, and to actually engage with members of these representative staff that say either they didn't know something or they're super engaged because we've visited. And the offices I visited, I've been to over the last 6 years multiple times, but there have been some staffing changes, and it never fails to excite me. And I keep hoping when I get on the plane that I keep that positive energy. I don't know, Suzanne, how you felt. It's always exciting.
100% Roz. So inspirational. And it was great to bring both the Policy and Advocacy Committee and the Transplant Policy Committee up to the Hill. And it's not just people that have done this for years and years, although it's really important for us as ASN members to do this. We also had people who were new members, who were the interns on the committees, because we really do want people throughout their experience in the nephrology community to be able to speak on behalf of the kidney community, to both talk about the importance of research funding to improve prevention, diagnosis, and treatment, as well as decreasing barriers to kidney donation. We really ran the gamut, and people were interested. And as you mentioned, the cherry blossoms were just about out.
So maybe we should focus on the asks. So there were two specific asks, and as Roz said, it was bipartisan and bicameral. So we visited, all the different offices we could, good group of people. So we had enough where we could really cover a lot of offices during that day. And maybe, Roz, why don't I start with you with the transplant specific ask?
Sure. So as many listeners may know, that there's been a stagnation in the number of living kidney donors now for quite a number of years. I think we reached the peak was maybe over 6,000 in 2019 before COVID. And then afterwards, we've really struggled to try to get more individuals, and we certainly have plenty of healthy individuals in the United States that could be donors. And part of it is these financial disincentives, taking time off from work, maybe losing your job potentially, certainly not getting your daycare reimbursed or your housing reimbursed. I mean, these have been challenges for people that are not particularly wealthy. And even if they are wealthy, there's expectations when you donate of how long you need to stay by the transplant center. And for years, we've tried to advocate for what's called the Living Donor Protection Act, which was very comprehensive, and it would get quagmired in committee because it was so complicated with too many asks. So I think it's been ingenious that Representative Dilbeny and I guess Representative Miller as well in the Kidney Caucus started coming up with new strategies. And so the HOLD Act, which was Help Our Living Donors, was passed this past year, and that changed how living donors could potentially be compensated for these unreimbursable expenses, normally linking that reimbursement to the donor's financial resources as opposed to the recipient. But now that we've moved on, there are other legislative opportunities. And the one we were advocating for was expanding support for Living Donors Act. That would really continue to work on the prior legislation, HOLD Act, increasing the reimbursement cap to $10,000, increasing the eligibility criteria to 700% of the federal poverty limit. Again, a modest increase really to try to get rid of this notion that you could lose money by donating a kidney when you really would like to donate a kidney.
So, Roz, just before we move to the second ask, I wanted to kind of clarify the point you made because I think it's really important that essentially, led by the co-chairs of the Congressional Kidney Caucus, the community has rallied around this idea of almost a two-step process. So step one was the legislation that was passed at the beginning of this year as part of the budget discussion and will go into effect. And then we're now focused on the second. And by doing that, we sort of simplified a complex piece of legislation to make it easier for Congress both to be supportive, but also, one of the real challenges with transplant legislation is it gets referred to a lot of committees. And I know in some of my meetings, that was an issue that kept coming up was anything we could do to simplify how Congress thought about transplant policy. So there's a lot in there. I guess my question is just if you could expand a little bit on the fact that we have this two-step process.
Yeah, and I think Suzanne may be more familiar because she's from the representative state and probably had many more conversations than I have. I mean, there's another son of or daughter of Living Donor Protection Act that has been, co-sponsored to date, really focusing more on the insurance aspect and having FMLA more codified. We've always tried to move some of this to the state level, but we've really been challenged because some states really don't have the wherewithal to sort of look into those issues, no matter how strong the advocacy is of the individuals. So I think separating some of this language and separating some of the needs, I think has really gotten people to sort of say, hey, there's nothing to lose by supporting this. And it doesn't have to go to 5 or 6 committees. We can really harness that particular energy and really push it forward. And I have to say that I was really impressed on the Hill Day how many people suddenly the light turned on and they said, living donation, why aren't we doing more? They understood the lack of access of organs, that we really are looking, at other systematic levels to improve the number of organs donated. But certainly live donation gives the best kind of organ because we screen the donor so heavily, and the better long-term outcome for the recipient, but also for the donor as well.
Thanks, Roz. I think you make an excellent point about how breaking down complex transplant policy, which at times can be daunting, especially if a staffer doesn't have as much familiarity with the concept, into more digestible pieces, help them really grasp the core issues and the value of living donation and allowed you to have conversations about living donation. Building on that, I think we should transition to our second Hill Day ask. Suzanne, I know the other ask was really focused on strengthening support for kidney research. Can you walk us through what we were asking for?
Sure. So our second ask was to support the Transforming Kidney Health Research Initiative, which was launched initially by ASN and many others in the kidney community back in the end of 2024, and we put out a report in 2025, specifically thinking about how to revolutionize kidney disease prevention, diagnosis, and treatment. And it actually calls for $1.8 billion annually over 10 years to accelerate innovations like artificial kidneys, other ways to think about screening and prevention, and aiming for a future without kidney diseases. And what was this based on? Well, I think it's important to recognize that if you think about the 37 million people with kidney diseases in this country, we get $19 per patient for research needs. And if you compare that to other diseases where we've seen really transformative changes in the care of patients over the last few decades, cancer gets $400 plus per patient, and HIV/AIDS on the order of 2,700 plus. And if you think about those fields and you think about how a patient with cancer or HIV or AIDS works, is treated within the system, it's really quite different now than it was in the 90s. If you think about how a person walks into a dialysis facility now versus the 90s, it's really not that different. And I think that we can do so much better. So this research initiative, which brought together, as I mentioned, not just the American Society of Nephrology, but also the pediatric groups, the American Society of Pediatric Nephrology, the patient groups, the National Kidney Foundation, AAKP, and the American Kidney Fund, along with a lot of community support. This is an initiative which really can transform. And so our ask was actually for a down payment on this request for $1.8 billion annually over the next decade. We specifically asked for $1 billion for kidney research within the NIDDK. And I would say that despite the very large number with a lot of zeros in front of it, we were met with understanding across the aisle in both the House and the Senate members who understood that we have a far way to go. And the fact that we spend $50 billion a year on kidney failure alone tells you that when we're reinvesting less than 1% back into research, it's a problem. We really need to do better.
So, Suzanne, I had the same experience you did, which was even in offices that I would think of as being sort of fiscally conservative, they recognized that it would make a lot more sense to spend limited federal resources on the sort of research side of this issue as opposed to the kidney failure side of it. And so we had really productive discussions. And one of the points that was made in one of my meetings was that we don't think about this disparity in research funding by disease cumulatively. In other words, we don't, if you think of just how much more money there is, say, in cancer, not to pick on cancer, but that's an annual, it's increasing almost exponentially by year as opposed to because kidney research has been so much lower for so much longer, it has this huge chasm when compared to these other diseases. And that started to land in a way that I thought, we even had someone say putting the kidney back in NIDDK, which I thought was an interesting way to say it.
I think another thing, reflecting on it is that so many of these other diseases that, I've lived through and involved in my career is they've always had unified voices that were extremely vocal. And I've always felt that our patients, for whatever reason, the lack of circumstances, how advanced, how not well they are, that they can't just pop out of and go to Washington, D.C. and lobby, that we really now have a much more unified voice. And I thought the report, when we presented it in our offices, to see the multiple organizations really, I think was sort of an eye opener along with the $50 billion on dialysis. But honestly, I don't think we as a field have really been able to have this unified voice. And I think it's terrific that we're all together working on this now, other organizations, to try to really move the needle finally.
I couldn't agree with you more. And when we spread the message that kidney disease affects people no matter what state they're in, no matter how rural, how urban it is, that it is a concern and access to care is an issue. And if you get to a situation where people never have to walk through the doors of a dialysis facility, wouldn't that be preferable? So that really spoke to a lot of people, and it's quite the aspirational goal, but I think it's a direction that we need to move, and it was great to spread that message out on the Hill, as you mentioned, Roz, on a spectacular day.
Dan, like I mentioned before, it's been a very busy month in DC, and this Hill Day also fell right in the middle or towards the end of the appropriation season, which is busy every year. Was there anything else that we asked for in relation to appropriations this year that you wanted to expand on?
Yeah, I do. There were two asks. I'll mention one. I may hand the mic over to my colleague, Dr. Mannon, for the other one. So we did go up and ask for continued funding for Kidney X, our innovation accelerator, to address issues around prevention, diagnosis, and treatment. This Kidney X initiative has been well received across the aisle in both the House and the Senate. It's a collaboration, a public-private collaboration between the ASN and HHS to incent transformation in the field. And we've awarded over 25 million plus dollars to over 70 groups to address things like transformation in dialysis or the artificial kidney or thinking about lowering barriers to transplant. And so we went up and are asking for $25 million in appropriations. Last year we received 5 million as we had repeatedly, and we'll see how popular that request is as we move forward for FY27. I'll hand the mic over to Roz for the second appropriations request on top of that.
So many of you are aware that the OPTN, the transplant network, is undergoing a major modernization, which ASN advocated for, and this was signed into law in 2023, I believe. And so the agency within Health and Human Services, the Health Resources and Service Administration, aka HRSA, is responsible for managing this gigantic system. And now it's out with multiple contractors. There's a new board. It's no longer UNOS as the primary contractor. It's expensive to do this. And with the multi-contracts and developing a modernized system, including the IT, which we desperately need in terms of available dashboards for patients to review, but also for organ donor offers, for example. A lot of these systems have not been updated for a couple of decades. So we had asked for an increase in appropriations to HRSA of 77 million from the current amount of 59 million. Again, things are moving along, but it requires quite a bit of money, particularly when you have multiple contracts coming out. You have to compete each of them and make sure you've got the right contracting partner. And I think the technological piece is not going to be an inexpensive piece, but one that is absolutely necessary, both for patients to access the system and understand the different transplant centers, but also to help programs manage their waiting lists, provide up-to-date information about organ offers in a more modernized context. That also, we do use it on our phones, but having really data that are secure is another critical ask.
So maybe we can shift gears a little bit. So we mentioned that this month has been full of activity up on Capitol Hill. So the other thing that happened was that Suzanne, in her role as health policy scholar, was invited to testify before a House of Representatives Ways and Means Committee, Health Subcommittee hearing on kind of two things. The way I would describe it, and Suzanne, I'm curious if you have the same description of sort of the focus of the hearing, but it was really around both, are there ways to improve the Medicare ESRD program, both in terms of how it delivers care, but also how we can use innovation to really move, if you will, upstream and think about identifying people at risk for kidney diseases and help to care for them so that they never progress to kidney failure. That was sort of one path. And then the other was around, are ways that Congress, through the Ways and Means Committee, can do more to be supportive of the 37 million Americans living with kidney diseases? I mean, it seemed to be the two kind of overall themes. I'm wondering if you felt that was kind of the purpose of the hearing.
Todd, I think that was absolutely the purpose of the hearing. And on top of that, the price tag was woven between both of those items pretty extensively. Both the chairman of the subcommittee, Vern Buchanan, and the ranking member, Lloyd Doggett,
Mm.
started out their opening statements talking about the expense. And the $50 billion that we mentioned earlier spent on kidney failure in this country was brought up again and again. And, you know, not to mention the cost of taking care of people with kidney diseases, which is substantially more, estimated to be on the order of just under $150 billion for people with chronic kidney diseases. We heard again and again the importance of patient choice, that people should understand what their options are, that there should be a lowering of barriers for people who want to access not just in-center hemodialysis if they have kidney failure, but also home dialysis, transplantation, absolutely. And it was even mentioned that people should understand they have the opportunity to pursue conservative kidney management. I think the patient's testimony was very powerful. She talked about starting dialysis without understanding there was an option for home. And then once she started one option for home, not understanding that home hemodialysis was an option on top of peritoneal dialysis. And then understanding that even if you did get a kidney transplant, which failed, which hers did very quickly, that it would be yet another very large journey to access the best therapy that she felt was right for her. So it was a long hearing. It was a lot of engaged members within the hearing. And the nice thing was that really all of the asks that we brought to the Hill were woven into the testimony and the questions that we heard, not just the Transforming Kidney Health Research Initiative, which came up again and again. They kept bringing up that it was a $19 per patient versus hundreds, if not thousands of dollars per patient for other fields. But we also heard about issues regarding access to transplant, including living donation. We had the congressional co-chairs of the Kidney Caucus at the hearing, both Congresswoman Miller and Congresswoman Del Bene. And then we also heard about funding for the Modernization Initiative and KidneyX. So it was a bit of a soup to nuts experience, but it was nice that everyone was so engaged, and hopefully there'll be a lot of positive effects on the kidney community as a result of this.
Yeah, and I mean, what you haven't mentioned, which I thought was interesting, is at the end of the hearing, the chair, Representative Buchanan, asked about nutrition and food, and
Yeah.
I thought that was a really interesting way to end. And as most people know, the relationship that ASN has with the kidney health, with the FDA, the Kidney Health Initiative, covers drugs, devices, biologics, and food. And so there is an opportunity, perhaps, to think creatively with FDA about some of those issues.
Roz, I know you were also tuned into the congressional hearing. I'm curious what you were thinking watching one of your colleagues testify in front of Congress.
The questions were not they were really probing, but in terms of trying to understand the aspects of kidney disease, I was impressed. Now, granted, this is, I guess, the subcommittee on health, how many of these individuals had comments, and I don't know Representative Smith very well. He's got this huge rural district, I mean, a huge district of Nebraska, like 85%, because it's a big spread out rural population. But I believe he and I think Representative Moore of Utah identified the challenges of having patients with kidney failure to try to reach a dialysis unit when the closest unit is so far away. And it's really not something that can be easily supported simply or financially, or to put a patient through that. And so them recognizing that home therapies is really something to really be providing an opportunity. And this is not like the 1980s and 70s. I mean, all these places now have running water, they have sewage, they have, the ability to provide safe and clean water for the most part, and do telehealth in terms of monitoring how patients are doing. So I thought that was like another win that you were just not really thinking about but I'm glad it was you, not me, because I would have had to pop about 100 beta blockers.
Yeah,
I appreciate that comment because I think I told more than a few people that I was feeling a little tachycardic during the hearing.
I will say I thought it was a good sign that before the hearing, the witnesses and then their representatives met in the committee's
Mhm.
library, and this is a committee that it's one of the original congressional committees, and so the chairs in the libraries, there's a little placard for any of the former members and current members who sat there, and I ended up in the seat that was once occupied by Wilbur Mills, who of course chaired the committee when it
Huh.
established the Medicare ESRD program. And that was just by coincidence. I didn't notice it until I sat down, but I
Mm.
thought that was a good sign. So Lauren, before we close with Suzanne, I'm curious as to your observations about the hearing because you were there as well.
Yes, I thought the hearing went really well, and it was really inspiring watching one of my colleagues sit at the hearing and being able to speak so well to the things that we're advocating for in the kidney community. And Suzanne, I actually wanted to ask you about after the hearing. We had the opportunity to speak with a lot of the Ways and Means Committee, both staff and the members themselves on the floor after the hearing. Did you want to provide any detail on what those conversations are like and maybe what the future holds to keep the momentum going from both our Hill Day and this hearing?
Lauren, I love that question. So it's a little bit of the behind the scenes or after the fact. Yeah, so the nice thing is that people from both sides of the aisle came up afterwards, both to emphasize the importance of getting dollars into the research environment to make sure we're doing better, not just for the people on dialysis, but rather to address things upstream, to partner with our colleagues, not only within the nephrology community, but also within primary care. We also heard a little bit about Kidney X, and they were very thankful that that had come up because they thought that that was one lever that could be pressed from a congressional perspective. That wasn't a lot of dollars from their perspective, but were important dollars to incent innovation and to shine a light on areas that private investors might be more curious about after getting recognition from both ASN and federal government. And I think, we also heard that they were interested in supporting people no matter what kind of coverage that they had,
Mm.
making sure that data was available appropriately on behalf of the patient community so we can understand what the outcomes were so we can do better for the future. I think that those are just a few of the tidbits that were mentioned after the end, basically showing that members were still engaged, that they wanted to continue to have conversation 2.5+ hours after the hearing had started. So I appreciate that question.
Suzanne, just before we finish, one of the witnesses was John Butler, who's the CEO of Akebia, and he spent a lot of time both in his opening statement, but also in the questions from the committee members, talking about TDAPA and antipodes or TPONIs, if
Mhm.
you prefer. Can you just give us the like 2 sentence explanation of what was taking place in that conversation between John and the committee members?
Currently, the Medicare ESRD prospective payment system is a fully bundled system, except for the physician payment. Everything from the machines to the nurses to the lights to the administrators are included in that bundled payment.
Mm.
And it was recognized by CMS that there were not a lot of dollars being put into research and innovation to think about new products because how would those get paid for out of a bundled payment system? Well, they did start to address this by putting in separate payment for medications that would be newly introduced into the bundle. That was the TDAPA, the Transitional Drug Add-on Payment Adjustment, as well as devices, which is the TIPNIs for new and innovative equipment and supplies. And what I would say is that it was recognized by John Butler and others in that hearing that this was a worthwhile attempt. It was an attempt, how wonderful, but that it didn't achieve what it was intended to achieve. That despite the fact that there were new medications, it wasn't incenting investment into the field, and even the new medications were not being utilized to benefit patient outcomes. It was also emphasized that only one item has even achieved the TIPNI's status for a new and innovative equipment. So I think the whole point was we were applauding CMS for their efforts, recognizing that these were not the right solutions and we needed to come up with newer solutions to get appropriate, innovative therapies into the hands of our patients and the providers to do better than we're doing right now for a population whose mortality is high, with more than half of our folks on dialysis dying in less than 5 years, and also suffering pretty substantially with regards to symptoms and quality of life. I hope that covers a very complex topic in a relatively short period of time.
No, it's helpful. And I think as we close, one of the things I was really impressed by during the hearing was Representative Kelly from Pennsylvania when he talked about his personal experience with his aunt who had kidney failure and was on dialysis, and connecting that back to both the patient representative on the panel, but also just being really thoughtful around understanding sort of the burden of disease. I just thought that was a really interesting moment in the discussion.
Yeah, I think we all wanted to meet Aunt Mary after hearing him talk about how inspirational she was to him. I'm glad that we're closing with a patient story because it reminds us of why we need to do better. And we can do better, especially as we bring attention to issues around kidney diseases, as well as upstream prevention and optimal therapies to improve people's quality of life and survival with a disease that most people would never have imagined. So thanks for the opportunity to do this podcast, Todd and Lauren.
Well, thank you, Suzanne. Thank you, Roz. And I should say the patient witness at the hearing was Ashley Littleton from Tennessee, and she was just fantastic. So it was really, and it was fun to get to know her a little bit, again, when we were in the library. Thank you for listening to this podcast by the American Society of Nephrology. I'm Todd Ibrahim, Executive Vice President of ASN. If you're a nephrologist, fellow, or kidney health professional looking to advance your career, stay informed, and build connections, I encourage you to become an ASN member. Membership, which is free to fellows and other trainees, offers exclusive access to groundbreaking research through our journals, discounts to live and virtual educational programs, including Kidney Week, and support of a global network of nearly 22,000 kidney professionals. To learn more or join ASN, visit www.asn-online.org.